What is it? And we got to get it. We really have to understand. So why is it that blacks tend to have it worse than whites when it comes to cancer of any kind, but specifically breast cancer?
So, a lot of it is still unknown, to be honest with you, but there is a large part of differences in access to healthcare, differences in, how patients are treated when they do come to medical attention. For instance, Blacks in the US and certainly worldwide are known to have a higher incidence of lack of insurance, underinsurance, and so they will not necessarily be able to access healthcare to the degree that their counterpart whites do. There are also other things such as differences in medical knowledge and education. So if a woman has a lump, for instance, maybe not really understanding that, this needs to present to medical attention for evaluation. Also, among our women, we do find, particularly in Africa, we do find a lot of denial. So, if there is a suspicion of cancer, nobody really likes to say the C word. There's neglect, and invariably cancer that is not treated will spread and eventually will kill, leading to bad outcomes. So while there's a large part of it being differences in access to care, social demographics, there are also differences in genomics, as well as genetics, as well as tumor biology, which is being actively investigated, and nobody really knows why those differences exist. There's been all sorts of postulations, such as differences in inflammation in the body, leading to perhaps higher risk of developing triple-negative breast cancer. There's some research looking at differences in obesity, differences in the endocrine milieu. So a woman developing, starting her periods much earlier, stopping periods much later, so going through menopause or the change of life much later. Also differences in breastfeeding. And all these kind of have a part to play in, risk factors for aggressive breast cancers.